Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. After a 9-month closure of schools across the country, the Minister of Education announces resumption of Unity schools on October 12. Adamawa State Governor Adamu Fintiri begins overhaul and upgrade of all secondary health facilities in the state, assures residents of better health care delivery. And U.S. President Donald Trump and his wife Melania Trump begin their 14-day self-isolation and treatment after testing positive to COVID-19. Even though this is still Independence Anniversary weekend, remember that the risk of transmission of COVID-19 in Nigeria remains high. Therefore, it is important to avoid non-essential social gatherings to remain safe. Now, on the 1st of October 2020, the Nigeria Center for Disease Control (NCDC) reported 153 new confirmed cases in 13 states and the Federal Capital Territory. Lagos confirmed another high of 81 cases, followed by Rivers State 21 cases, while the FCT confirmed 11. 8 cases were confirmed in Ogun State, 7 in Kaduna, 6 in Oyo, 5 in Akwa Ibom State, 3 each in Osun and Katsina States, and 2 each in Edo, Ebonyi, Nasarawa, Plateau, and 1 in Kano. Lagos is still the epicenter of the virus, managing 4,088 cases, followed by Oyo. Plateau State is next before the Federal Capital Territory. Now, apart from states like Enugu, Gombe, Rivers, and Nasarawa State, other states have below 100 cases currently on admission. Till date, total confirmed cases has surpassed 59,000 cases, while 50,452 cases have been discharged, and we have lost 1,112 people to the virus. Africa's most populous nation has tested almost 510,000 of its 200 million population. Nigeria is 4th place with the highest number of cases in Africa after South Africa, Egypt, and Ethiopia. The West African nation ranks 55th in the global numbers. Meanwhile, more cases are still being recorded around the globe, with the U.S. president and his wife announcing that they both tested positive to the virus. The president confirmed this on his Twitter handle after one of his aides initially tested positive for the virus. Mr. Trump had earlier said himself and the First Lady will begin quarantine, as is expected to affect his campaign process and disrupt planned rallies and interviews. The United States is the worst hit, with the highest number of cases in the world, over 7 million. Also, the highest fatalities, now at over 207,000, 8 months after the first case. India is in 2nd place with the highest cases, followed by Brazil and Russia. The federal government has ordered the reopening of all Unity schools in the country from Monday, October the 12th. The Minister of Education, Mr. Adamu, says the decision to reopen schools is due to the fact that the COVID-19 curve has been flattened. He explains that schools across the country are at liberty to fix resumption dates with adequate safety measures in place, but with caution that school owners who fail to comply with the safety standards risk closure if there is any outbreak from such learning facilities. The federal government announced the closure of all schools in the wake of the coronavirus pandemic in March. According to the governor of Adamawa State, his administration is not resting on its oars in the response to COVID-19. Governor Omar Fintiri gave the assurance while kick-starting the rehabilitation and upgrade of all secondary healthcare facilities across the state. He says that the COVID-19 pandemic has indeed exposed the weakness of the country's healthcare delivery sector and strongly believes that upgrading the facilities in the state will help contain the spread of the dreaded coronavirus.
The case for the upgrade of Mobi General Hospital has become more compelling in view of its strategic location as an international gateway and the only facility providing health services for millions of our students in the entire northern zone of the state into the southern part of Borno. The COVID-19 pandemic has not only exposed the weaknesses of our health infrastructure, but the gross inadequacy of the facilities required to confront contemporary public challenges. May I use this opportunity to assure the people of Mobi that the current project, which involves the construction of outpatient, maternity, laboratory, and theater complex, will be pursued with the utmost vigor and will be completed in 6 months' time, so that the people of Mobi will enjoy improved health services in no distant future.
And 6 months after the Yobe State government shut down schools, the governor, Mai Mala Buni, has directed the reopening of all primary and secondary schools across the state on the 12th of October. The Commissioner of Basic and Secondary Education told Channels Television that necessary measures have been put in place by making sure the resuming students comply with the NCDC protocols. While appreciating the patience of parents and private school managers, he also warns the government will not take it lightly if any school intentionally or ignorantly refuses to comply with these safety protocols.
We have secured the approval of His Excellency, the Executive Governor of Yobe State, to reopen our schools on the 12th of October 2020. He has also directed that we should make sure that we observe strictly and adhere to the protocols provided by the NCDC. The Yobe State government will not hesitate to provide succor for the private school operators within the available means. However, we are also directing all private schools to strictly adhere to the guidelines provided, that government will not take it lightly with any school that is not complying.
Now, the Kano State Governor Abdullahi Ganduje is advocating the need for more collaboration between the federal government institutions and the government in order to kick out COVID-19 in Nigeria. While receiving members of the House Committee on Health, the governor promises to continue to support both state and federal healthcare facilities in order to avoid a resurgence of COVID-19 in the state.
Without doubt, the year 2020 has challenged Nigeria as a country to ensure a more effective healthcare system due to the COVID-19 global pandemic. In Kano State, the synergy between the state and federal health institutions saved many lives, as well as curtailed the spread of the dreaded virus.
In collaboration with them, fighting against COVID-19, we provided them with some personal protective equipment for their doctors and other health workers in the hospital.
For these lawmakers, to further strengthen the fight, executive arm needs to give account of its performances.
It is the performance of the budget of 2019 and 2020 that will come to look at the hospitals, to interact with the leadership of the hospitals in this zone, to know what that we have to do, using our legislative instrument to work on the system, to make sure that we have some reasonable improvement.
Back at the Africa House, situated within the Kano State Government House, Governor Abdullahi Ganduje was conferred with an award for his excellent participation in the federal government N-Power program.
We have the highest number of beneficiaries, but that is not surprising. We are the most populous state in the federation. So even if you will go by ratio, we should have the highest number. But our efforts do determine for us to have the highest number of beneficiaries.
At the moment, Kano State has the highest number of applicants in the country, with a total of 286,339 applicants.
The beneficiaries will soon be captured Your Excellency, this indication shows whatever percentage is given per registration per state, Kano State will definitely emerge the highest with the highest beneficiaries.
While the state continues to tackle unemployment, manage the spread of COVID-19 and feed in its poor, state governments assured that more human capital development programs are on the pipeline to assist the state's teeming unemployed youth. Idris Jubrin, Channels Television News.
The Nigeria Institute of Medical Research, NIIMA, unveiled the first COVID-19 Summit testing kit to boost Nigeria's testing capacity. The PTF has applauded the invention with hopes that after validation, possible deployment of the test tools will scale up testing in Nigeria, while the Senior Research Fellow at NIIMA, Dr. Chika Onwama, he joins us via Skype from Abuja. Thank you for joining us on the program. First, tell us about your presentation to the Senate committee.
So everything went well. First, thank you for having me. We first had a presentation to the Federal Ministry of Health, and both ministers of health, the Minister of Health, the Minister of State for Health, they were present, and a lot of other committees of people working on the COVID. So after we presented what we have done thus far and our own in-house validation, it was clear to them the assay was working. We were able to do a demo there, and then they just asked us the things we need to put in place for other agencies of the government to also verify with us, and then before we can say we want to roll out. And so next day yes.
Go ahead, finish.
The next day we were at the Senate building. We actually made a presentation to the Senate Committee on Health, and they received it very well. In fact, they were very enthusiastic, and the key question they kept asking us was, when are we going to make this commercially available? And my DG, everybody's taking it up to see how fast we can move on this and get it to the other agencies to see. In fact, after we finished with the Ministry of Health, we actually spent some time at NCDC. Even though we couldn't test so much, we were able to just share what we've done with them. And we're also very excited, looking forward to when we have everything available for them to be able to do the required testing, and then we can move along with it.
So if our testing right now across Nigeria is over 500,000, deploying SIMA across the country, how much does that drive the number of tests we can do in a week, and also the price of testing for COVID-19 in Nigeria?
It will drive up the testing because people will not need to wait for the testing, big testing centers where you have a lot of gadgets and all that to do the test, and that can come out in 24 hours or 48 hours. So you can just have it at the side lab, at the clinic, or whatever you need it for, and you can do 32 people in about an hour. And then the cost is also cheaper. So these are some of the things we hope we're able to achieve with it, because we set out with that intent to break the hold, so I can go as low to whatever facility and people can test. We've been testing since February, and it's been a lot, very hectic. And as we are opening up, there's a need for other people to be able to test. I'll give you two instances. People coming in, it's possible that maybe while they are coming out from the planes, they can just maybe we have a do-it-yourself kit, swipe themselves with the video that will tell you how to do it, and then before you go through customs and pick your bag, your result may be ready. The second one, we have people that were going for surgery.
Okay, Dr. Chika Onwama, we appear to have lost you there. We do apologize for that, a bit of the technical issue, but we'd like to thank you. That was the Senior Research Fellow at NIIMA, Dr. Chika Onwama, talking to us about SIMA, which is hopeful that it will boost Nigeria's testing capacity if deployed across the country. Well, let's take a quick break. When we come back, more on the global response to the COVID-19 pandemic. Now, EU leaders have gathered in Brussels this week for a two-day summit where they are seeking to bridge disagreement over everything from sanctions on Belarus to its historic coronavirus aid package. Deutsche Welle correspondent joins us from Berlin to tell us more. Chelsea Delany, thanks for joining us. First off, EU's €750 billion coronavirus stimulus package appears tied up in disagreements. Is there any progress on getting the money to countries in need? All right, we'll try and get back to Chelsea shortly. But then let's tell you the biggest news this Friday is that US President Donald Trump and his wife have tested positive for COVID-19 and are now in isolation. The president, who is 74 years old and therefore in a high-risk group, announced the news in a tweet saying that we will get through this together. Well, here's more on the global update.
Just about 4 weeks to the U.S. presidential election, President Donald Trump announced in a tweet that he and his wife Melania had tested positive to COVID-19. The president's result comes after months of downplaying the severity of the outbreak that has killed more than 207,000 in the country. Hours before this news, it was reported that Hope Hicks, a close advisor to Trump who traveled with him aboard Air Force One several times this week, had tested positive. According to Mr. Trump's physician, both the president and his wife are well at this time, and they plan to remain at home within the White House during their convalescence. As expected, international reaction has been trailing the news. UK Prime Minister Boris Johnson tweeted that he hoped the couple both have a speedy recovery, returning the favour to Trump, who tweeted support to Johnson when he himself was in hospital with COVID-19 in April.
Looks like by April, in theory, when it gets a little warmer.
Indian Prime Minister Narendra Modi says he wished the first couple a quick recovery and good health. Meanwhile, spokesperson for the French government says the president's diagnosis demonstrates that the virus spares no one, including those who have shown skepticism.
And I will use it gladly.
Just a day before he tested positive, President Donald Trump attended a rally at an airport in Minnesota. As has been the case at most of his public appearances, the president did not wear a face mask. The crowd was not socially distanced, and most of those who attended appeared to have not worn face coverings either.
47 years of betrayal and 47 years of failure.
Well, let's tell you that the Imo State government has fixed Monday, 5th of October 2020 for schools to resume across the state. This is after 7 months of closure due to the pandemic. The Commissioner for Information and Strategy, Mr. Declan Imilumba, disclosed this after the weekly Executive Council meeting at the Government House. He said the government has already mandated a committee headed by the Deputy Governor to ensure that all modalities are put in place for schools, especially to the adherence of the COVID-19 protocols. Now, we told you earlier, EU leaders gathering in Brussels this week for a 2-day summit seeking to bridge disagreements over everything from sanctions on Belarus to its historic coronavirus aid package. Deutsche Welle correspondent Chelsea Delaney joins us from Berlin. Hello, Chelsea. First off, tell us about EU's billion euro coronavirus package tied up in disagreements, and if there's any progress on getting the money to countries that are in need of it.
Well, really not much to speak of in terms of progress, and that's a big disappointment to many countries in the EU that desperately need this money. If we recall a few months ago, it took a very long time and it was very difficult to get this 750 billion euro stimulus package passed in the first place. And after it was, there was a lot of celebration. A lot of people said this is really a historic moment. It was able to come together behind this package. But since then, we've seen a lot of infighting and a lot of disagreements pop back up between EU countries. And right now, the big sticking point is this provision that would link the distribution of funds to the so-called rule of law. And that would really target countries like Hungary and Poland that have slipped a little bit democratically, and it would make it more difficult for them to get money from this. That has been really controversial. We've heard proposals from several EU leaders, including Germany, but right now there is still a lot of pushback to the entire proposal. So it is unlikely that this money will be distributed by January as had been expected. And at the same time, many countries are seeing an increase in infections, and many countries are having to implement new restrictions, particularly Spain, which had already been hit very hard and had seen one of the biggest economic contractions in the second quarter. So this really does just underscore how crucial it is for EU leaders to come together on some sort of agreement to help these countries get the money as soon as possible.
Now, the EU has been criticized for its soft power foreign policy approach. Will this summit change the EU's foreign policy strategy?
So this is a major discussion today, and over the past 2 days. The EU does have a foreign policy program. The EU acknowledges this itself. They say that they have very strong nouns but weak verbs. So they are good at doing things like symbolic sanctions. They can really put forward a lot of symbolic measures, but they also have really lost a lot of respect and a lot of their reputation as a very strong player in the international world. So we've seen this really play out over conflicts over the past 2 days. For example, sanctions against Belarus for its disputed election and crackdown on protesters. There had been a widespread condemnation of the election among EU officials, but actually imposing sanctions had been held up, and some internal disputes between EU countries. They were able to come forward with a plan for sanctions against Belarus today. But this is part of a broader discussion about how the EU can be more effective in its foreign policy, and that likely will require bigger changes, for example, to the unanimous voting requirement for foreign policy proposals. So the discussions are heating up. They are getting more intense, but it is part of a longer term shift in EU policy.
Finally, Chelsea, and this is away from the EU meeting, we understand that Germany has issued travel warnings for more than 10 European countries, and Berlin lifting a general travel warning for 160 countries outside the EU. Can you tell us a bit more about that and what the impact is?
So the impact will likely be fairly minimal. The Germany did lift these restrictions for the entire world, but they still have many restrictions in place. So they have about 130 countries that are still on the quarantine and travel restrictions list. And they're within the EU. There are about 17 countries that are on the list as well, and they have another 50 countries that the government advises against traveling to. So there's still many restrictions in place for people traveling. Basically, only a handful of countries within the EU are available to be traveled to and from without some sort of quarantine, without some sort of testing requirement. And at the same time, the German government is planning to phase out free testing at airports here for people returning from high-risk areas. So it's still very difficult to travel within Europe and outside of Europe as well. And I think given the rise in cases that we're seeing within Europe, the German government and the European government in general still very much wants to contain the risk that comes with international travel. So not a lot to change on that front anytime soon.
All right. Thank you so much, Deutsche Welle correspondent Chelsea Delany. Thank you for that update. Of course, remember that a decline in cases doesn't mean the curve has been flattened. Continue to take responsibility. Visit our website, channelstv.com. You get more updates, a better understanding of the pandemic, plus several other stories you can see there. While it's positive for some, it's negative for others. U.S. Secretary of State saying he feels fantastic. He's negative for COVID-19. There's several other stories. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.